Good evening, everybody. My name is Cristobal Jr., student physical therapist assistant. Today, we're going to go ahead and discuss TENS, what it is, its indications, why we'll be using it in a clinical setting, precautions as to why we might and might not use it, contraindications where we'll completely avoid using TENS, how we'll use this specific device, the TENS 7000, and then a brief demonstration on myself of me utilizing this device to go ahead and treat some pain. So, like I just mentioned right there, it's mainly to treat pain in local areas. Maybe it's because of brain signals just sending off pain receptor signals where we're perceiving these pain areas in patients, ourselves, whoever it is. So we're going to go ahead and use an electrical stimulation device just like this to go ahead and send electrical signals towards the brain to reduce those pain signals. That can be either through gate control theory, opiate release, or descending pain theory. We'll go ahead and touch more about that when we're setting up the device and showing you different parameters. Some of the precautions where we're going to need either a physical therapist or the physician to clear a patient of using a TENS device is if they have any cardiac issues, if they have any impaired cognitions and sensations, if they have any impaired cognitions and impaired sensations, if they have cancer, and if they have any cuts or wounds in the area that we're treating. So with those mentioned precautions, we'll go ahead and talk with a physician or physical therapist to see if a patient is good to go with TENS, and if they are, we'll go ahead and apply it. As for contraindications, when we're going to go ahead and avoid using a TENS unit, that's going to be if a patient is pregnant, if a patient has any pacemakers, deep vein thrombosis, and we're definitely not going to be placing these around their eyes, around their neck, because we want to avoid the carotid artery, onto their chest, and lastly, we're not going to place it on their gonads. So let's go ahead and show y'all how we set up this TENS 7000 device with the parameters, explaining each little bit of it, and then we're going to go ahead and do a brief example on myself to address my shoulder pain today. So here's our TENS box that we got our unit inside of, obviously taken out, and it also comes with a battery. We'll go ahead and remove this back plate and then just place the battery right over that black ribbon so we can go ahead and pull it out whenever we need to, nice and easy. Slide that cover. Now that the battery is in, we can go ahead and turn the unit on by lifting this cover and twisting the knob. This is our intensity knob, and we'll go ahead and touch more about that later, but this is pretty much how we turn it on. We'll go ahead and twist it. You hear an audible click and also an audible beep. We'll go ahead and lift this cover, and here we can see some brief settings about how we turn the power on with this twist of the knob, selecting different modes up here, selecting different settings to change these numbers and parameters, and then increasing or decreasing the settings once we have the information selected. So I'll go ahead and touch on the mode sources right now. Right now we're on normal. We have modulation, SD1, SD2, and a nice one that comes with this device on the TENS 7000, burst. We'll touch that for a specific modality that we can use using this device. But for right now, let's go ahead with normal. This is where we're going to go ahead and see different settings for conventional TENS and acupuncture TENS. Let's go ahead and talk about conventional TENS. Conventional TENS is going to be this tingling sensation that we're sending to the local area we're treating. This is for the gate control theory. What gate control theory is it's sending stronger electrical signals that are more receptive to the brain. So that way we're feeling the electrical signals more rather than the pain. So it's pretty much electrical signals beat those pain signals to the brain. That's what we're going to sense. With the parameters to set it up to get that type of treatment with conventional TENS, we'll go ahead and press set. Our width is flashing, and these numbers will go ahead and be between 50 to 100. So we'll go ahead and just leave it at the 100 that it was at originally. Regarding pulse width or pulse duration measured in microseconds, it's going to be very, very brief, along with it being the higher the number, typically the more muscles are felt to be contracted. So we can go all the way up to 300 and it feel like it's hitting much more muscles with much more depth. But for the sake of conventional, we'll go ahead and be around the range of 50 to 100. Today, we'll keep it at 100. We'll go ahead and press with rate. Rate is pretty much the frequency, how fast something is going to be sending to us. If we're all the way down here with 2, pretty much it's sending a very small bits of taps going on. But if we go all the way back up to the 150, it's going to be very, very fast taps, just like that. That's how fast the stimuluses are being sent. With time, this can be adjusted to however many minutes or hours one might like. This goes all the way up to where it can just have no time limit at all. It could be continuous, or it can just be as short as 1 minute. For clinical sakes, we'd typically be around 10 to 20 minutes just for time purposes. But if for a person who has this at home, they can go ahead and set it as long as they want to go ahead and receive their treatment. So these would be our parameters for conventional, with time being the adjustable parameter based on what the patient would like. And obviously with width 50 to 100, rate 30 to 150 hertz. So the other form of treatment that we can go ahead and adjust these numbers to while we're in normal mode is for acupuncture TENS. What acupuncture TENS addresses is descending pain theory, where it's pretty much sending signals to the brain to go ahead and reduce the amount of pain that we are receiving. This is much better in a case for people with chronic pain issues. We'll go ahead and adjust our settings for acupuncture TENS. Right now we're changing our width. Our width can be either from 100 all the way up to 300, which is the max setting that we get on this unit. We'll go ahead and press set. We'll go ahead and set our rate between 2 to 5 hertz, and this will go ahead and send a frequency rating of 5 hertz or 2 hertz through the wires once it's connected. So we can go ahead and send brief taps towards the skin. You'll see it occur when we do our acupuncture treatment. For timing, let's go ahead and press set one more time to get to the timing. Our time parameter would be between 20 to 45 minutes for treatment time when it comes to acupuncture TENS. Now, when it comes to our last mode, burst, we'll go ahead and change these numbers because they'll be presetted, where our width is going to go ahead and be between 150, so all the way down to 150, and all the way up to 500. However, our unit only goes up to 300, so we'll just stick to 150 to 300. Our rate is locked at 5 hertz, so we'll go ahead and be between 2 hertz to 5 hertz for this frequency. It's almost like acupuncture in itself, but it's a very, very strong stimulus. And it'll just go like bam, 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 bam. That's going to go ahead and address both the gate control theory of sending stronger signals to the body to block pain receptors, along with promoting endogenous opiate release, which can help with sending natural opiates towards the site of pain for about 24 to 48 hours. With burst, we'll go ahead and be at less than 15 minutes for treatment. With this TENS device, we're not seeing a dedicated on-off time, since technically it's going to be continuous with treatment. There is nothing for vector scans where we're choosing and changing treatment areas. Treatment area is typically going to be wherever we place the electropads. There's no scan setting where it's going to go ahead and automatically adjust between a frequency range. So whatever our frequency is set at, that's what it's going to be unless we adjust it. And there isn't a ramp setting for us to adjust the on-off delay where it's sending the gradual stimulus. It will just be right away sending that stimulus. So that's where adjustment of intensity will be. And I almost forgot to touch on about the intensity dial. This intensity dial is patient dependent on how much intensity they want to handle for electrical stimulation. They can send themselves a lot more electrical stimulation to be stronger, or they can send weaker electrical stimulations towards the electropads placed on their treatment area. Depending on the parameters that they have for their choosing, they can go ahead and adjust this to have more of a motor twitch response, or they can have a different response for just tingling. Obviously, that will also be dependent on the rate and the width that they go ahead and decide. But this is for their comfort and feeling of the stimulus. So I'll go ahead and show you guys how I get this set up on a patient, and today the patient's going to be myself. So when we're using the device on ourselves or a patient, we'll make sure that the device is off before we use it. So then we'll go ahead and plug in our electrode wires. We can either use 1 or 2 channels. Today, for the sake of demonstration purposes, we'll just go ahead and use 1, but if necessary, we can go ahead and use 2. And then with the 2 wires attached, we can go ahead and adjust the intensity for both channels at different feelings. So one area can have more intensity than the other and vice versa. To make it easier for electrode pad placement, we can go ahead and attach these right now rather than waiting for it to go on the skin. So one end of the prong goes into the end, and then the other one goes into the other end. Just like that. And then before we place it on the patient, we'll go ahead and wipe the area with alcohol. Today I'll go ahead and treat my shoulder in a brief demonstration. So my treatment area is going to be my shoulder, so I'll go ahead and take my scrub top off, and then I'm going to use this alcohol wipe to go ahead and remove any sweat, dirt, debris, whatever could go ahead and interfere with our electric pad, and it just keeps the area clean for stronger electrical stimuluses to be sent. Just wipe the area real quick. For pad placement, we'll go ahead and centralize the treatment area. So if my pain is right here, I'll go ahead and place the pad right above and right below it. So then the treatment area is in the center of the pads. So right there, it's right on my deltoid. So we can go ahead and treat this area where I'm feeling the most shoulder pain, typically whenever I'm doing movements. I'll go ahead and turn the device on. And I'm going for the acupuncture treatment because of it being a chronic issue. So I'll go ahead and start my pulse width over at 150. So we can be at the lowest width setting for right now. And we can obviously adjust that mid-treatment. And then my rate will be at 2 hertz. Just to show you again, here's my width at 150 hertz. And then my treatment time, obviously we're not going to go through the full 45 minutes. We're just going to do a brief, and you guys will see that muscle twitch going on. I'm going to set that at 20, and then I'll go ahead and adjust that intensity knob until I'm feeling this motor twitch sensation going on. Right in there, right away, we're at intensity 4, and we're seeing the fibers twitch up. I think I could turn that up more, because it's going to be at my comfort level. Right there, we can go ahead and see motor twitch going on. Strong contractions, I'm feeling like it's a actual muscle pump going on. It's a tap, 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 tap going on for our acupuncture setting. I'll go ahead and show you guys also what it would be like if it's conventional. So let me adjust this width down to 100. And then I'll dial down the intensity first, and then I'll change that rate to be between 30 to 150 hertz, and then I'll change my rate to be at 30 hertz. So we got width setting at 100 and rate at 30 hertz. So this will be addressing conventional TENS. And right away, I feel a bigger difference rather than taps going on with muscle fibers. It's almost like something is crawling on my skin, or it's like driving in a car on a bumpy road and it's very constantly vibrating. That's what I'm feeling going on in this shoulder with these tingling sensations. I can go ahead and adjust that so it can be stronger with the width. We're not seeing too much muscle fiber contraction where it's like the tapping. Very, very small ones going on in here. And then my intensity, I can just adjust that the way I like it. And then with burst, I'll go ahead and show you guys that too, what the effects are. We'll change my width to 150. And we'll be at 5 hertz. Let's change that intensity. It's almost similar to the acupuncture with twitch going on, but almost like a bit faster rate. But then that is because my frequency is at 5, so let's go ahead and reduce that down to 2. Now feeling that pretty much be like muscle contractions, muscle twitching going on. I'm doing nothing and it's just going at my arm. This is addressing endogenous opiate. Maybe we could turn that intensity down. Maybe it's a little too strong. No, this is a comfortable. And obviously intensity is based on patient comfort. So if a patient would want to have very, very strong contractions and that's comfortable for them, sure. But maybe if it's just light like these ones, this is okay too, as long as we're seeing some sort of muscle activation going on. So I went ahead and turned off the device. Now it's safe to go ahead and remove the pads and place them back on we'll go ahead and place it on our pad holder. Unplug it. Right away, I can feel some pain relief going on with my shoulder. Obviously it's a chronic issue, so other methods like ice massage can go ahead and help this shoulder issue down the long run. But here's another way to go ahead and do some pain control using electrical stimulation. So that's our 10-7000 unit summarized in this video as to why we would use it for pain, when we may and may not use it, when we'll completely avoid it, how to set up the different parameters utilizing the different numbers and buttons. It's a relatively cheap unit to buy off Amazon, or we can get it prescribed by a physician and physical therapist for patients to use to address their pain. For any questions, go ahead, feel free to leave comments below, and thank y'all for watching.